programs, part of the curriculum or anything. This is purely a club-sponsored event, and so all the rules apply. We are concerned, however, about HIPAA and such, so please, nobody can record today's talk. I will be recording, as will Michael, for the club, and we will post these for viewing only on our website. So, and also with HIPAA, please do not talk about this patient outside of this room, and should you happen to see him in public, do not approach him and talk to him about the case unless he approaches you first and says hello. As those of you who are third and fourth years already know this. The first and second years, if you ever see a patient in public, you cannot approach them and say hello unless they say hello to you first. And that's as a student, as a doctor. As far as the Naturopathic Society goes, we have some great, exciting things coming up. Today is our first kickoff for the grand round. Next month, the end of March 28th, we have Dr. Goldhammer from True North, who is the fasting guru up there. They do all kinds of healing through fasting, high blood pressure, chronic disease, etc. And then coming in May, some of you already know, we're very excited, is we have Dr. Daniel Moshi doing a holistic counseling certification. If you haven't looked at the website yet and checked out his videos, it's absolutely amazing how he achieves such amazing results in a 90-minute session. We will also have a live patient for that in May. We'll be doing an actual counseling session live here at the Grand Round. So we're trying to find volunteers for that, so stay tuned. And then what else we have going on? Next Saturday, we have Dr. Hazel teaching on self salts and naturopathic pulse and tongue diagnosis. A couple things that we don't get here at school. And then I think that's.
We're trying to get Dr. Kane to possibly come and do a homeopathy case and try to bring a real patient as well for that. So I just wanted to tell everyone, if anyone has any suggestions as topics that they want us to do, we're more than willing to hear what you guys want, because we have board meetings to think about what you guys want. So my name is Susan. You can email me or anybody who sends anything out from the Naturopathic Society and respond to it and say, hey, I'm really interested in this topic, and we'll try to find a doctor who is very nature care oriented who addresses that.
Yeah, typically we're looking for cases that we may not see in the clinic to address and to teach those to the students and how to approach those from a nature cure perspective. And Dr. Kane uses the therapeutic order to treat her patients, and it's really amazing. We all know the therapeutic order, but it's really amazing to watch a doctor actually use it philosophically as they approach the treatment of the patient long term. So stay tuned for that as well. And
Sorry, battery died.
Kyle, can you run to the copy center and get us a good one, please?
Well, just put it on your tongue.
They're sharp.
Would you like to try that?
Yeah.
I'm not putting it on my tongue.
If it really hurts, it's good. If it doesn't hurt at all, it's dead. I'll tell you here. Can I try?
I want to see this happen. Bring them out.
I'll tell you which ones are good.
They're all bad.
What you guys do is good. Turn on. This one's got a little bit left.
So I'd like to kick off this specific meeting. My name is Stefan Kasian. I'm a lifetime member of the Naturopathic Society, and I wanted to thank Ron and Sue and everybody else for being part of the Naturopathic Society and helping to make this be the amazing organization that it is to help us bring to campus speakers and opportunities we would not have otherwise. So let's just give them a warm thank you. And our speaker today is Dr. Joe Tafur. Well, I had first heard Joe speak at an event outside of school, but interestingly it was hosted to the SCNM community. And he spoke at the Southwest Herbs, I believe. And I was really amazed by his work. And the reason why it's so interesting for us as students here, many of you and many of us I know are interested in global medicine. We have a vision of medicine and healing. This is way for you to see that medicine and healing can be what you want it to be. The center was created out of his vision of what's possible, going beyond his original training, but including his training as well. And I had gone there in 2012. I had such a profound experience that I brought a group of other students with me. So many of you are here today. I can embarrass you by having to stand up momentarily. The students who want the 2013 trip. This is an opportunity to experience nature cure at its finest at the basin of the Amazon River in Peru, and seeing a fully functioning center with an MD or a physician running it, a shaman, and some really exciting visionary art as well. So you'll hear all about that. And this is also an opportunity for you to expose yourself to clinical thinking that you may not otherwise see, and to go simply beyond a certain way of practicing, because you're able to pollinate your mind with other thoughts from other fields. So without much further ado, I'd like to introduce Dr. Ford. Give him a warm welcome. He earned his MD at UCSD, and over the years has spent extensive time in residency and research, especially in psychiatry, behavioral medicine, and then spent over 7 years going to Peru to study with a master shaman. And the shamanic indigenous healing traditions have much to teach us in the way of how to heal the root cause, going and working with nature and the spirit and looking at the root cause of illness and giving us an opportunity to do that. So I wanted to, again, thank Dr. Ford for his busy schedule. He's in fact leaving for Peru shortly, so he was able to share us his time, and here we go.
Thank you, Stefan. All right, thank you everybody for coming. I got my presentation here. It's just jam it in. I don't want to say a bunch of other stuff, but I also want to have plenty of time for questions and just introduce Russ, who's also here to talk about his case. Can you guys hear me? Is my microphone set up? All right, so here's the talk. It was advertised PTSD addiction. The focus is PTSD today, and we'll touch on addiction. It's my background. He touched on it. Just where I went to medical school, integrated medicine, did research in psychiatry. I'm a family medicine doctor. I work here for Cigna part-time as a temp. Just was there earlier today. And then since 2007, I've been going down to the Amazon and training with shamans there. This is the group we had from here, SCNM, 2013. You might recognize some other people that I'm here today. So there's me with the dog, Happy. And then in the back is Wheeler, the shaman in the red shirt. In the back there's Ricardo, he's the master shaman. It's actually his vision. Our center is his vision. And then Smita and I support him and have our own vision for things we want to bring. Smita, who's sitting in the back right corner, is a visionary artist and healer who's bringing that side of things in. And then me, I'm just in mental education and integration. So here's a little artwork based on an ayahuasca vision actually that I had. It inspired a lot of this idea, these ideas that I have about how to integrate science and the healing arts. And so a lot of what I'm trying to share with you is things I've learned in my studies, but also a lot of it has to do with what I've learned there in the Amazon with the plants themselves. So that's what I'm into, is trying to bring the feeling back into healing. I know that's what's going on here. I'm medical school, a real conservative situation. It wasn't so much that way. So that's our center there from the plane. We fly over, you can see it there, nestled in the Amazon rainforest. It's called Niue Rao, Centro Espiritual. Niue Rao is a Shipibo term. We do traditional Shipibo medicine. Shipibo is one of the native tribes of the upper Amazon Peru. And it's a spiritual center because our focus is in spiritual healing. That's the tradition. There's Iquitos, that's where we are. So Iquitos is on the Amazon River. You see Peru there, the coast, Lima, Machu Picchu, you may be familiar. And up there, then the Shipibos themselves, most of them are from that region, Ucayali Basin, and they come to Iquitos to greet tourists. So this is our center, it's our website. We're a traditional Amazonian healing center. We practice traditional Shipibo, shamanic, and plant medicine. Like I mentioned, they're from the Ucayali region. We heal through plant medicine, traditional Shipibo diet, which I'll explain a little bit, and with master plants and other healing plants. We also use traditional ayahuasca ceremony. So traditional ayahuasca ceremony is for the most part illegal here in the United States. There is completely legal in Peru. There is at least one group right now in the United States, the UDB, Unidad from Brazil, a church religious organization that has a religious rights to use ayahuasca here for their religious rights, but also for spiritual healing. So here's my partners again, this Ricardo Maringo, Shipibo shaman, master healer, and Stefan from Canada, visionary artist and up-and-coming healer. So we have an integrated approach. We do have an art model of people who do our work. That was part of the group that we had with the naturopathic students last time. We have visionary artists kind of guide through the process. We have visiting healers come. Sometimes we have an energy healer or acupuncture or body work, different things available. But the central thing is the traditional Amazonian healing. So we're getting more attention. Amazonian ayahuasca shamanism. So this is from the LA Weekly about a month ago. Vine is dead. Ayahuasca can change your life so long as you're willing to puke your guts out. And New Times, I don't know if you guys saw the New Times, it was a few weeks ago, they talked about peyote way, peyote medicine in the peyote church here in Arizona. When you cover all this interview, I got a few quotes there. That's their website. If you're looking, that's a organization that's operating above the water in Arizona. So Amazonian medical tourism, so there's all these people going down to the Amazon right now, the way people used to go, or maybe still go to India or to other parts of the world to see kind of other cultural traditions, spiritual traditions. So people are coming for healing, for learning, for exploration. Those seeking shamanic healing are most often coming for problems for which they have not yet found relief. It could be psychological, psychiatric, psychosomatic, or if you will, spiritual. So the ayahuasca tea, this is the controversy here, but this is, like I said, a sacred medicine there in Peru, in the indigenous tradition and respected culturally by the government. And so the ayahuasca tea, you may have heard of, is part of the traditional Amazonian plant medicine, larger body of knowledge. So there's a lot of other things going on in plant medicine in the Amazon, like traditional Chinese medicine or Ayurvedic medicine. But one of the central components that's getting a lot of attention, getting a lot of interest, is the ayahuasca tea. So this is the first time I went to see ayahuasca tea get cooked, and the guy was wearing a Phoenix Suns hat. I'm from Arizona. So this is, ayahuasca is made generally from two components, and it can be made different ways. At our center, this is how we make it. We make it from the ayahuasca vine, which is Panis cerealis, which is known there. The spirit of the ayahuasca vine is considered to be like a mother nature spirit in the Amazon, the mother spirit of other plant medicines, and a connection to the spiritual realm. Then it's mixed with chacruna. That's what we do at our center. We cyclotrophere these. These leaves are cooked together with ayahuasca vine after it's smashed, and a big lasagna and cooked all day, concentrated down over time. And you make the ayahuasca tea. So the chacruna has the DMT in it that's getting a lot of attention here. It's a hallucinogenic molecule, very strong hallucinogen, but it's also something that's been found within all animals and plants, generally speaking. It exists throughout most species, and it's definitely inside of human beings. And so people are starting to look at, where is it in there? Why is it in there? Because when you give a little stronger dose of this molecule, people generally have mystical experiences. So it seems that perhaps the DMT is related to the spiritual machinery, the mystical machinery of the human physiology. And that if there are mechanisms there that lead people into visions during meditation or during near-death experiences or perhaps even during dreams or other forms of a mystical phenomenon, that perhaps this kind of machinery inside ourselves is being activated or turned on by endogenous production of DMT, for example, or some other system. So Rick Strassman is a researcher who wrote this book, DMT Spirit Molecule, about his research with DMT at the University of New Mexico, which was the first kind of psychedelic to be researched again since that was shut down in the early 70s. And then they've been moving DMT, the Spirit Molecule. Mitch Schultz made that movie. It's a very good movie. It's on Netflix if you want to check it out. So then there's MAPS, I always try to promote MAPS. MAPS is a multidisciplinary association for psychedelic studies. So there's a big renaissance right now. The government, the DEA, all these different powers that be are allowing a little bit more psychedelic research once again. Was shut down in the early 70s after initially people were very interested in possibilities for psychotherapy assisted treatment. So they had their big conference this year, Psychedelic Science 2013. Some of the big things that came out of the conference were MDMA assisted psychotherapy for PTSD. So MDMA, which is ecstasy, Molly, a component of the ecstasy, is being investigated once again because of some big results they're getting with PTSD. First with trauma victims, people with sexual trauma, different kinds of abuse. Then now looking at the vets, which is getting interest from all over the world, in the Middle East, now from the Pentagon. And now locally, conservative elements of our society, firefighters, police, they're looking for help with this problem because they're not having success with this problem. Other research outside for end-of-life anxiety, people who are going to die and there's nothing that can be done, they're anxious about dying, having a mystical experience to help them to meet death. And this was one of the first published studies on this ayahuasca, traditional ayahuasca use was therapy for addiction. And that's led to a bigger study they're trying to do out of Canada, the Ayahuasca Treatment Outcome Project, which is trying to do clinical research there at the centers in Peru to try to evaluate what kind of results are coming out there. So drug versus ayahuasca medicine, I just want to touch on something. There's this idea of, from the Western scientific perspective, that ayahuasca is just a delivery device for DMT. It's just all about that hallucinogenic. You can just smoke DMT or you can inject DMT and you're going to have this kind of experience. That is not our experience. And so this whole plant tea that we use is a part of a larger spiritual context that seems to be very vital in getting the kind of results that we're able to achieve. And as opposed to like a counterculture, like I was bringing up, hallucinogenic, people getting away from their families, from their parents, and doing different things from their societies to get high or trip out. This is a very conservative element of the culture where you're doing it with grandma present, the kids, the babies, the shamans are there. It's a family thing, and it's about healing families largely. So this is what we offer people typically. This is the people healing diet, and so this is offered pretty much to all of our patients, regardless of diagnosis, different forms of this. This is also how you train to become a shaman. The same treatment protocol that you use to heal somebody is the treatment protocol that you use to learn. And so that's how it works. So then everyone that comes through our center, it's not an easy process. You can ask these guys to pass around. It's difficult. But all of us have done that. We've gone through it. We've gone through more of that than they have. So we're not asking anyone to do anything that we don't do. So you come in, you have to take a vomitive at the beginning. That's the big, exciting opening. Take a plant-based vomitive, throw up and open your diet. This is the sacred diet. This is a period of purification. You review your intentions with the shaman. Most likely with a translator, myself or someone else, and try to figure out why you come. You're going to be assigned a master plant, generally speaking, a plant that's not necessarily psychoactive in any way, shape, or form, but it's going to be there as a plant medicine for its herbal properties, for its pharmacological properties, or for its spiritual properties to help assist you through your process based on what you're asking help for. Then you're going to be placed on this vegetalista diet, this very strict diet that is a form of malnourishment. It's not the pinnacle of health. It's about a spiritual cleanse, but generally speaking, it's no salt, no sugar, no oil, no fatty foods, no spicy foods, no dairy, no red meat, no pork, no sex, no alcohol. So like Ricardo says, if it tastes good, it's not good for the diet. And then you may also be in isolation. So then part of your process, your healing process may require you to be in isolation in a tambo in a hut in the forest, to get away from social interactions, and to really go deep into yourself. Your treatment might also include topical plant treatment. Sometimes we use poultices from there within the tradition, large traditional plant medicine. Vapor treatments, steam treatments with different kinds of plants for a variety of reasons. Plant baths, flower baths, different forms of baths. Then we do have the ayahuasca ceremony. So we do our ayahuasca ceremony Monday, Tuesday, Thursday, Friday. So it's a pretty rigorous schedule. The patients are not obligated to drink ayahuasca at all. Period. No one has to drink ayahuasca, but we do ask that people come to the ceremony. The shamans are going to drink ayahuasca. That's part of their tradition. That's how they open themselves to the connection that's going going to the ceremony, traditionally, not necessarily to drink ayahuasca, but to receive healing song. And that is one of the most crucial parts of the treatment that we offer. That, it's a lot of times people kind of get lost in the idea of DMT or doing this. It's like they're going to be part of the ceremony, and a huge part of what's going to happen to you is receiving songs from shamans and being guided by songs through the experience. And yes, then you are invited to drink ayahuasca as well for healing. Afterwards, we have a post-ceremony conversation and counseling, depending one-on-one, and groups, however much time we have for people, we try to give that to them. And that's a round, that's a form of rounds, just like in the hospital or whatever, you're gonna do rounds in the morning. Okay, what do we need to do? How are we gonna adjust the treatment? How are we gonna adjust the ceremony? You continue that diet process until you close. It could be days, it could be weeks, it could be months, you treat them for a few months, and for long-term training, it could be 1 year. So we're gonna talk today with Russ. Just leaving him as Russ. He's here. He's signed off, so we can at least call him Russ. Russ is a dear friend of mine, and he's a 60-something Vietnam vet who was one of the first people that I brought down there for healing before we had a center. So I'm just gonna try to just breeze through. PTSD. We got at least there is criteria for what is PTSD according to the DSM for research purposes, etc. This is the kind of person who's exposed to death or actual, this exposure. It's some kind of exposure, a direct exposure or indirect exposure or repeated or extreme indirect exposure. And characteristics, first, you have to have that kind of exposure. Second, there has to be evidence of intrusion symptoms, which I'm going to describe, persistent avoidance of stimuli associated with the trauma, and another category, negative alterations in cognitions and mood associated with trauma, and alterations in arousal and reactivity. So the intrusion symptoms, these are the intrusion symptoms, you have to have at least 1 of 5 to be diagnosed with PTSD. So you have recurrent involuntary intrusive recollections, traumatic nightmares, flashbacks, intense or prolonged distress after exposure to traumatic reminders, marked physiological reactivity after exposure to reminders. Next, the next category is avoidance. And so you have to have an avoidance to trauma-related thoughts or feelings or trauma-related external reminders. Negative alterations in cognition and mood that began or worsened after the trauma. So you've got these 7, you have to have 2 of 7. Inability to recall certain things, like dissociative amnesia, persistent negative beliefs, the world is completely dangerous, I'm bad, persistent distorted blame of self or others for causing a traumatic event, persistent negative trauma-related emotions, fear or anger, guilt, shame, so the big ones. Markedly diminished interest in other activities you used to get into, feeling alienated, constricted affect, can't really express positive emotions. Next category of things you need to have 2 of 6 of these trauma-related alterations in arousal and activity. So irritable, aggressive, self-destructive, reckless, hypervigilant, exaggerated startle response, concentration problems, sleep problems, and all these B, C, D, E categories you have to have for at least a month. And have to have significant symptom-related distress and functional impairments. How does it affect your life? How does it affect your family? And it can't be due to medication, it can't be due to substance or illness. Some of the guys, they're getting caught up in substance, but it can't be because of that. So I'm going to introduce briefly Russ's case. As I mentioned, it's PTSD, Vietnam vet. So just to touch on, this related criteria, Russ, we kind of talked for a while. He had some trauma exposure. He was raised in a violent community in Trinidad, Colorado, and he had some pre-exposure to violence and traumas before going. That's predisposed people to PTSD. Eventually, I guess to get out of trouble, he enlisted in the military, and he was trained to be a medic in Vietnam War. And he worked in the infantry initially, so he's dealing with booby traps. He tells me booby traps now we call IEDs. And gunshot injuries there, humping around. But eventually transitioned over to the air ambulance, which is, I guess what they call the dust-off crew, dust-off boys. So those are the helicopters who go in to pull people out, medical helicopters pulling people out who are in, life-threatening situations and who have been, blown up, etc. And his helicopter, that he told me he's been shot down, multiple times, and he's 7 times, broke down for mechanical reasons, and other 7 times. He was wounded twice by fragments. So pretty significant exposure to traumatic events. So as compared to this Operation Enduring Freedom, which is the Afghanistan situation. situation, and Operation Iraqi Freedom. The Vietnam War was characterized by civilian guerrilla warfare and this decreasing social support. The negative homecoming reception was a big deal, you know, people coming back and getting spit on. So a sense of lack of support from society and or family is a strong predictor of PTSD beyond combat exposure. So Vietnam vets have this, you know, on top of all the rest of it. So Russ tells me he returned as kind of an adrenaline junkie, like some of these guys do. So he went out to a ranch in Colorado to try to kind of, you know, decompress, and eventually made his way back into education. Got a master's in counseling, became a master's in social work as well. Continued in the reserves. So he's, you know, functioning fairly well, having some, you know, family difficulties perhaps. And he says in 91, 92, when the Gulf War started, we began to have more difficulty with his PTSD symptoms. And then the second Gulf War, you know, kicked up, and now things were getting worse, more difficulty with anger. Through those 90s, he also kind of was developing some other comorbidities. You know, some chest pain in 92 led to bypass surgery, heart, started getting treated for hypertension, starts getting treated for cholesterol stuff. 1997, he's got some stents placed in his heart to keep things flowing. And 98, starts being treated for diabetes. So, you know, you can see this not atypical, you know, here in America, but also with all these other things going on into it. 2003 to 2009, he started psychiatric treatment. You know, kind of got the diagnosis of PTSD, started being treated there at the VA. So they put him on fluoxetine, Prozac, SSRI, and bupropion, Wellbutrin. Started treated there. Also started going to group and individual therapy at the VA weekly for 5 months. He says he's going to speak for himself. He describes to me that this was not really that impactful, you know, these treatments that participated in. You know, just no, PTSD vets coming back, there's some research, 70% come back with prescribed psychoactive medications, 50% are prescribed at least 3 meds, and 20% are prescribed 4 or 1 meds. PTSD treatment, just to touch on it, like some of the treatments that do appear to work, you know, this cognitive processing therapy is a certain form of cognitive behavioral therapy. They say there's strong empirical evidence for treating PTSD. So a significant contributor to the interruption of the natural recovery process is the ongoing use of avoidance. So avoidance being the key issue to address. So they call that these stuck points, you know, things that they avoid. So they're trying to help them to re-engage these stuck points, emotionally process around this stuff. Decrease self-blame, decrease acceptance, trying to get people to increase safety, trust, power, control, esteem, intimacy through 12 sessions of this form of psychotherapy. Another form of therapy that's showing strong evidence for effectiveness is prolonged exposure therapy. So there's another form of therapy where you do this again, like the other one. They also spend some educational time with the guys or the women to tell them, okay, this is, you know, what we're going to do. This is how it can help you. This is what it's good for. Help people kind of understand why. And then they do this in vivo exposure and imaginal exposure. So they are encouraging them to retell the story of what happened, what was the traumatic event. And you do that over and over again until it's slowly used, you know, with the support of a therapist. So they said either imaginal or in vivo, putting them in situations that make them uncomfortable. So they have had good results. The problem is less than 10% of the VA therapists routinely use this therapy because they say because they're not trained to do it, or people don't want to do it, or because it's too intense. But the idea is to facilitate emotional processing so the problematic traumatic memories and avoidance is slowly desensitized. Another area, another approach that seems to be getting good results in different kinds of PTSD is EMDR, eye movement desensitization, reprocessing. So it's again emphasizing disturbing memories as the cause of the psychopathology, and that's what you need to approach. So they have people recount these memories, but they use the distraction of different kinds of sensory integration, distracting eye, having them follow fingers with eyes. That disrupts the processing there, and the sensory integration system of the body. They're able to work through some of this stuff without freaking out as much. So reduce the lingering effects, let them have more adaptive coping mechanisms, 8-step protocol. So recall distressing images while receiving one of several types of bilateral sensory input, including side-to-side eye movements. That's another approach that has been successful. So what would you do? So we're a little behind, but not that far behind. We're slowly catching up. So like 5 minutes. This is the template. Just throw it out to you guys. Do you have any ideas? What would you do? What have you heard about in comments from the crowd?
Hypnosis.
Hypnosis. Okay, so I haven't read too much research about hypnosis, but yeah, that's possibly that would be another approach.
The problem with hypnosis is that the memories may be so disturbing once they're coming up that how do they process it? Or the memories are too traumatic, they can be processed with hypnosis. So it has its limits.
Yeah, so that could be the problem. Yeah.
Pet therapy, I've heard of
Pet
that.
therapy, I've heard pet therapy too. I've heard people having good, experiences working with pets to again like bring down the general arousal.
Like horses, there's a place in Florida that works for the VA that does let them come into the horses.
Yeah, so that's also very interesting, and it's related to, in a way, I think, to what we do. There's also guys too, like in San Diego, there was some kind of farm type thing, like Russ went to the Colorado Ranch, like go decompress around nature. Yeah. Chakra therapy, I'm not as familiar, but I'm sure it's relevant. So working with the chakras, like energy healing type stuff. Breathwork therapy. Breathwork therapy. Okay. Guided imagery. All right. Homeopathy. We're at the SCNM. There are options here. Good. Okay. Well, those are a lot of great options. We did something else, and we're going to describe that a little bit. This is the first time we went down to Peru with Russ. We called it Spaceship Earth. It was the first group that I led. It was 10 individuals. Miguel, bottom left, is my brother's father-in-law, and Russ is a good family friend. So they came along for this adventure where we took 10 people. We had 10 people down in a group program, just 10 days. Traditional people dieta. Russ, I believe, was at your master plan, so I was trying to dig up my papers on that. I think you're on Ayahuasca and Ahosacha and something else.
Ahosacha.
Yeah, Ahosacha. So he was put on a couple other plants. They knew about diabetes, they knew about other stuff, and they knew about trauma. So we just put on some additional plants, and then there were 5 traditional ayahuasca ceremonies as part of that diet. Okay, 10-day diet. So that was the first treatment that we received from us. Just 10 days. So it's like we get all this criticism for hallucinogens or whatever, or it's illegal. It's like here you guys said, putting these guys on, psych drugs for 40 years. And we're just talking about 10 days of the class. So again, this is what he went through, what we reviewed, okay? He returned from Spaceship Earth. He told me that he was willing to participate in an integrated program with the VA that he had known about before, but didn't feel ready to do until he got back. Did that, thing, so he had further healing, coming home, looking for other forms of therapy. Stopped the psych meds before coming to Peru, and then stayed off since then. Since 2009, now we're 2014. Had some weight loss, we was able to get some benefits around blood pressure and blood sugar control, at least in part. Then he came back to help assist another friend who wanted to come down, and then for his own experience for 3 weeks. Now this time, 3 weeks, traditional people diet, different plan. You Pino Blanco this last time? Master plan was Pino Blanco, okay, to try to help him spiritually primarily. Then 12 ayahuasca ceremonies in that period of time, for 3 weeks. Not necessarily drinking ayahuasca every time. I think there was at least one that he did not drink, but the rest of the time going through the experience. Continued improvement, like a massive drop, at least initially, in his blood pressure that was complicated because his medication had to produce medication for some period. So that's the basics. I want to bring Russ up here now to share, whatever elements he wants to share about his experience. Then I'm going to talk about some theory and stuff afterwards, and then we'll have chance for questions about all this.
Can you hear me?
Yep.
Okay, I'm kind of shy, so. And for those of you young ladies looking at you, he is single. I told him I would have him a date before the class was over. My major issues were anger management. I was a road rager. I hate rude and spurious people. I still do. It didn't cure me from that. But The first trip down there was just mind-blowing experience. I mean, first night I took medicine, and I choose to call it medicine. It felt like every synapse in my brain was firing. And I can't imagine other than maybe some electrotherapy that would cause that. But I think it helped reroute some of my patterns, my neural patterns. I'm not a doctor, so if I use the wrong words, you guys can correct me. Oh, and you can call me Russ. My last name is Benicki. If you see me in public, you can talk to me anytime you want. I felt pretty comfortable with myself. I always have felt comfortable with myself. I did experience a lot of trauma in Vietnam. It's more vicarious, I think, trauma, just seeing all the guys wounded, dead people every day. And I did come back in adrenaline junkie. I mean, I would do anything to try and get that high again. There's nothing like getting shot at to boost that adrenaline. And I tried to do all kinds of stuff when I got home, partying. And I'm not a drinker. I like to be in control, so I never had an excuse that I was out of control because of drugs or alcohol. I still don't drink much. I still like to be in control. So those were my basic issues. A little bit of hypervigilance. I probably have 10 of those things, but they never did bother me. And career-wise, I worked for Maricopa County my last 18 years as a human resource person. I ran the employee assistance programs. They used to send me all over the county to deal with stuff that nobody else wanted to deal with. Too quiet. Okay, I can talk louder. Sam, you don't tell me you talk too loud, so I'm trying to just be louder. I was HRVP at the hospital and the medical system for 2 different stints. Whenever they had problems, they would send me where they didn't like, and nobody else wanted to go. I like doing that. I'm a pretty pro employee. I was president of a large union at one time, public employee union, and I was pretty intimidated. You think a little guy like me was intimidated? People were afraid of me, and so I let it be free. It worked to my advantage. I'm not that bad. I never went off and beat up anybody at work or that kind of stuff. By all standard measurements, I was pretty successful, career-wise. But I think because I got to do things that I liked to do. My job changed enough every 2 or 3 years. I have a short attention span. It goes more than 3 years. I'm struggling by the end. And I was fortunate to have a job that changed every 3 or 4 years. And my staff still calls me to go to lunch with them and stuff. And it's been almost 10 years that I've retired. We talk about the old days, how they miss me. People wouldn't ask them when I was around. And now it's kind of changed now. It's pretty sad. I'm a big believer in integrated medicine. My grandmother was a herbalist, and I used to go with her when I was a kid. She raised me from my grandfather till I was about 9, 10. And so I had a pretty good experience there. And she was very disappointed when I didn't want to become a healer. We call it curanderos in Spanish. And that was one of her objects that she wanted. Oh, you learn this after somebody's telling me. So I've been exposed to alternative medicine since I was a kid. She was the doula for the whole community on the ranch area. People have babies, she'd go over there and help them deliver. I don't know this for a fact, but I've heard rumors she assisted with abortions verbally back in those days when it wasn't too popular. But so I was very fortunate to be exposed to that stuff very early in my life. When I was the benefits manager, that was one of my other hats I had at times for the health system. I mean, for the health plans that we had. I got them to go ahead and do a little bit of naturopathic stuff that we would pay for. You know, I don't know if they're still doing that. Like I said, it'll be 10 years in August that I get retired. But the main thing about the trip to Peru, just getting back on topic, is it was a very mind-blowing experience for me. I would not recommend anybody going to a 3-day kind of ayahuasca ceremony, because I think there's a lot of important things that go along with it. The diet is very, very important, you know. And a lot of people go and get high for 3 days, and you know, that's okay, I guess. It's not what I'm into. But I think it's okay after you've been once, just go get a tune-up and stuff, you know. The people that I've got with recommend a tune-up every year or two, you know. I had such visions that were profound that I'm still processing to this day. You know, I saw a battle between spaceships, and where one of them came down and killed all these people from India, and I didn't even know what that was going on. I wasn't afraid or anything, because I was just like an observer, like at a movie. Came down and blasted all these elephants and soldiers and stuff. And there was a girl from, not a girl, a woman from Seattle that was at our debriefing, and she asked me when I left, "You know what you saw?" And I said, "No, just what I said." She said, "You saw the battle between good and evil in the Sanskrit, in the old Hindu tradition." And I said, "Oh, really?" So I've been getting into that stuff. I like that kind of stuff. Learn why I do some of the things that I do or did in terms of with my girls. I tell them be home at a certain time, or tell them what time you're coming home when you get older, and don't be late. Because when anybody was late in Vietnam, you had to go get it. Somebody was in trouble, you know, and it wasn't a good thing for people to be late. And that stuck in my mind, and it just carried over to my life, you know. And that was one of the big epiphanies I had. I think the main thing I've read about the whole PTSD thing is how I was with my kids, my daughters. You know, I didn't have any sons, so with my girls, and I think I did a lot of damage to them. And that's pretty hard to admit. You know, because if you met me anyplace else, everybody would think, "Oh, he's such a nice guy. He's just so lovable and so friendly and so outgoing." I'm not really shy, like I said. And so that was some of the stuff that we could deal with. One of the things during one of the ceremonies, I went and visited my girls. I looked at them just like I'm looking at you folks right now, and they were sleeping because it was late at night. So I just looking at them and apologizing to them, you know, for the crap that I put with you, just for the stupid be home on time thing, you know. I talked to my mother and my grandparents who are dead, just like I'm talking to you people. I mean, it was powerful. It was very, very, very. I had some issues with my mom. She was dying from cancer, and she told me when I did that, we smothered her. Oh, we got getting on bed. Yeah, I smothered your mom. Couldn't do it. So she suffered for a couple of days. I got some really big guilt after that, you know. She was a big Orkin fan, you know, and that's just when he was getting in trouble. And we talked, just like we're talking now, and she told me, she said, "Son, you know, I should have never asked you to do that. I'm sorry I did that." Because I was really feeling bad. I tried the traditional stuff with, you know, talk therapy, what do you call that stuff where they wiggle their fingers?
EMDR.
Yeah, and it didn't work. So the guy bought a machine, a light bar, where you look at it. He gave me a headache, you know, that stuff just didn't work. And I guess I was still resistant and not open to all that stuff. And But when I got back from Peru the first time, let me tell you that. Peru was very much like Vietnam. Big jungles and animals in the jungle, and snakes, and critters of all sorts. And I went to the town like Joe was talking about earlier one night, and I'm not used to going any place unarmed, no knives, no guns, nothing, and just sat in this tumble and listened to all the noise that was going on, things glowing in the dark, bioluminescent kind of plants and animals, I guess, I don't know what it was. And for about 45 minutes, it was really hard just to be there by yourself, like I said, no knife, no gun, no nothing. And finally, I just came to peace with it. Fell asleep, woke up in the morning, went back. And that was a big thing for me, because there's always something that will get you in the job, if you're not careful and stuff. But to be able to not do it with a knife or a gun was a big deal for me. And so I don't carry a gun anymore. I still carry a knife, but not with me now. And I think without what happened there, when I got home, that was in 2009, I think we went, in February, in February of 2010, I went to an intensive PTSD program at the VA of Tucson. They have a special one for that, I don't remember what they call it, but I would have never gone if I hadn't gone to do the Peru thing first. And, I don't know. I guess I don't want to go over too long because I can talk forever.
Just a couple more minutes, and then we'll go back at the end. We'll go back and bring you back.
And then
A couple more minutes to say.
a couple more minutes. I have changed a lot. Not so much that I don't get angry anymore. The other day we were at science and my grandson and I, and this dude was texting. You're looking up at the stars and all of a sudden this light comes on. Okay, man, I said, turn off the machine. And he kept texting. I said, if you don't turn it off, I will turn it off for you. And so I still have that. When I retired, I grew my hair long. That was one of my bucket list things, And I couldn't believe how different people treat you when you look a little bit different than they look. Had a guy come in and cut to the front of the line when I was buying my cigarettes, which I had quit smoking since October when I was in Peru. I quit buying, let me say that. And because to the front of the line, there's people buying lotteries and stuff there. I said, oh, hell no. I said, get your ass back alive. And he's looking at me like he's all suited up and stuff like I used to be, And, he got to the back of the line. The ladies behind me started clapping because they were a little upset because he got in line. But nobody was saying anything. And I was just raised to be very courteous, very respectful. And I do treat people that way. I have people say, I wish I could be like you. Humble. I'm not humble. I'm just respectful, And that's something that will never probably go away from me, and I'm okay with that. I made peace with that this last trip down there. The last trip down was a whole lot different than the first trip down. It was more for healing, body and stuff. And all that stuff that Joe said that I had, the diabetes, the heart issues and stuff, I never realized were related to the Agent Orange that we spread on us when we were in Vietnam. I think, try to remember the stats right, and I could be off a little bit. We have a 30% higher rate of diabetes than the general population. About the same amount of heart issues, the ischemic heart issues that I was treated for twice. And never even thought about it, never thought about that stuff. And I'm kind of angry. I still have problems with authority as well, so that won't go away either. But and these guys that are coming home from Iraq and Afghanistan have been exposed to this depleted plutonium, and they're like saying that that's okay. kinds of weird stuff, and it just pisses me off, excuse my language, that they're still exposing it knowingly that stuff's not good for them, and denying that it's okay. So I do a lot of veteran activism. I was pretty much an activist when I was in college, university and stuff, in terms of Hispanic issues, Chicano issues, we used to call them in those days. My time's up.
Just for a minute, we'll bring Russ back up. All right.
All right. Thank you.
I just want to try to get through some of the theory and stuff, and then we'll bring Russ back up at the end for some questions. So he's got plenty of time. So this is a segment, a little template. What's our process down there with Russ, with cases like Russ. So this is me and Ricardo, Ricardo and I. So our treatment is traditional in the sense that he is supervising all the treatment. Ricardo is the master of plant medicine and the singing to him in the ceremony. It's all about that. And then we have some integration, because we're exposed to the world, things that we're exposed to, and so he's learning from us, and we're learning from each other. That's the maloca. This is where the ceremony happens. This is the famous ayahuasca ceremony goes on in there. So a lot of cleaning and cleansing, like Russ was talking about, like this time was more physical, wasn't so psychedelic. It was more physical cleansing of the body. A lot of times that just turns out to be a lot of vomiting and diarrhea and sweating and a lot of uncomfortable things. Ceremony, just a little shot of somebody about to drink some ayahuasca there with our we live. We usually have 2 Ricardo and another 2 shamans. Sometimes we have 3. Right now there's 4 shamans total around the ceremony. Then there's the ceremony itself, which can be visual, doesn't have to be visual, sometimes is. This is Pablo Marigo's art. He's an ayahuasca shaman that painted some of his visions and the songs, used to guide the process, and then one-on-one healing. So this is some science and stuff that's going on right now. This MDMA, I mentioned the psychedelic. MDMA is considered psychedelic. Molly or the ecstasy that's being utilized once again now in PTSD treatment. And so these are the first publications to come out of their research. And it's just first one that proved that it's safe and it's not causing problems. Again, they're not, people are worried about people burning out on too much ecstasy from MDMA. They're doing 2 or 3 sessions, that's it. That's what these people are going through with psychotherapy before, in between, and after. And they got, so far 83% response in the treatment group. So there's a lot of interest right now in this. So it is growing. This is like their other, they're saying how psychiatrists, psychotherapists in Switzerland used MDMA legally as a prescription drug to enhance the effectiveness of psychotherapy. Early reports suggested that it was useful in treating trauma-related disorders. And then, as I mentioned, with all the delirium, the kind of wildness that happened in the 60s and government response, psychedelic therapy or within some kind of healthcare system was shut down, and now it's beginning to be looked at again, and they are getting results, and so that's what's drawing all this interest. So it does seem that there's something about this psychedelic approach that seems particularly interesting for cases like PTSD. So the limbic system, this limbic system we're going to touch on here. Here's some stuff they're showing where is MDMA acting on the body. And there's showing, it's working on these percent the rat hippocampus, that's a limbic organ. This limbic system, emotional processing system in the brain, subcortical brain, sensory integration system, acting on the limbic system. This other study, then even marijuana. Some of the veterans are turning towards medical marijuana, and then what about those compounds? Some cannabinoid compounds that also seem to be really limbically active or paralimbically active, and you see results in trauma-related stuff. So there's a big researcher, Bessel van der Kolk. He's talked about, a few words from him. While transformation of memories of day-to-day experiences is the norm, the flashbacks and other sensory re-experiences of PTSD seem not to be updated or attached to other experiences, triggered by a reminder the past to be relived with an immediate sensory and emotional intensity that makes victims feel as if the events were occurring all over again. Patients with PTSD seem to remain embedded in trauma as a contemporary experience and often become fixated on trauma, like in other research, like CPT research, they talk about stuck points, this idea of frozen trauma in the body. So he says, this researcher that's been doing a lot of research, my friend went to a psychotherapy conference about a few weeks ago, and he was saying, PTSD needs a limbic focused approach. we need to focus on the limbic system of the brain, the deeper emotional processing center, the subconscious emotional stuff. That's where you're getting results. He's saying the antidepressants, the meds, they're not really working on this frozen trauma. You know, they're treating symptoms, but it's not really getting there. And he's speaking from his experience of running those research trials and not seeing results. So, you know, then it's kind of like begs this question as we get into the spiritual healing realm, the shamanic realm, you know, the idea of an emotional body. You know, we talk about chakras, we mentioned chakra healing, some energy body, some emotional body in there. This idea of frozen trauma will somehow exist within that part of ourselves, and how would we address it? So, I want to introduce to you guys to this, and perhaps you've already seen it, but you know, this mind-body medicine that's kind of growing. There's some real strong science, there's some well-articulated like understanding of the connection between the mind and the body now. And two of the fields that are kind of related, perhaps part of the same field, psychoneuroimmunology and psychoneuroendocrinology, are really interesting. So this is something I know you guys probably got exposed to in your training, the idea that HPA axis, the hypothalamic pituitary adrenal axis, the HPA axis, which is part of our stress response system. So you have the hypothalamus there in the middle there, you get the cortex above, hippocampus, amygdala, hypothalamus, pituitary, all kind of participating in the limbic system. They're communicating to the HPA axis, to the adrenal cortex and your adrenal glands, leading to cortisol reduction, you know, the stress hormone cortisol, causing all this stress damage when it's overutilized. That's communicating to the immune system, white blood cells and different parts of the lymph nodes, all parts of the immune system. And these things are all communicating with each other. And like I was trying to bring up, you know, before they said, oh, the brain, the neurons are making these neurotransmitters, and the adrenal, the endocrine glands are making these hormones, and the immune system is making cytokines and inflammatory markers. But now they're realizing that all these different organ systems that were compartmentalized by, you know, the MD side of things of our understanding are actually sharing these molecules. So these guys are making neurotransmitters, and these guys are making hormones. And it seems like maybe they're part of a network of some larger system. So this psychoneuroimmunology, psychoneuroendocrinology is now an area, this system is a focus to study how does stress cause disease? How does stress lead to high blood pressure? How does stress affect your immunity, your ability to fight disease if you're stressed, if you're depressed? Are you sick more often? Now they can kind of understand why. You know, maybe too much inflammation in your blood fighting cancer or something like that, then can also feed back to cause depression and where you are. So this is a real interesting field. Here's the limbic system. So those little elements I mentioned, the thalamus, hippocampus, amygdala, hypothalamus, there they are, sitting there kind of centrally in the brain, underneath the cortex. So PTSD in the limbic system. So PTSD is associated with smaller volume, left amygdala volumes. So that little spelling error. Decreased activation of the prefrontal cortex, which is the paralimbic area of the cortex connected to the limbic system. Decreased activity of anterior cingulate gyrus, another paralimbic system. So there's a lot of stuff going on in the limbic system in PTSD. And it's funny because then beside MDMA and psychedelics, well, they're very active on the limbic system. And then this limbic system is also like a central hub connecting out to the psychoneuroimmunologic apparatus, psychoneuroendocrinologic apparatus. So they're saying PTSD is kind of a failure of extinction of fear conditioning. Another study shows thinner prefrontal cortex in veterans with PTSD. So the limbic system is associated with episodic autobiographical memory, your sense of yourself in the past, your emotions, your goals, mental reliving of an experience, emotional processing, social processing, our relationships. So the limbic system, the development of the limbic system happens, you know, first in childhood infancy, and it's developed in response to our relationships with other people, in response to our relationships with our parents, our caregivers, and that is what you know, guides the way you're going to develop your emotional reactions, your social processing, your socialization, and then also would be affected later in life by serious trauma, emotional trauma. There's also dreams are there in the limbic system, sexuality. So, you know, when I was learning about this system, I got exposed to this system. I'm like, wow, these are the topics that come up in ayahuasca ceremony all the time. This is what people are talking about every morning after ayahuasca. And so, wow, this seems really important. So the same researcher, Vanderkolk, says the brain stem, so that's the, you know, the brain stem, kind of more the reptile brain, it's simpler, more ancient brain, and you get these limbic or hypothalamus limbic system, and then the neocortex, the brain above, the human brain, the abstracting brain, the thinking brain. They're constantly monitoring relationships with the outside world and assessing what is new, dangerous, or gratifying. So you have this system that is constantly integrating, and at the subcortical area and the limbic area, it's constantly integrating. How do you feel inside? Interoception, what does it feel like to be in your body? What do I feel like inside my guts? What do I feel like inside my heart? What does it feel like, anywhere in my body? And what are my senses picking up from the outside world? And there's a constant integration that goes on there at that center, a sensory integration center. And that's there in this limbic system. And so it's a question mark of, okay, here's something happening to me in my life. This is what I sense with my senses, and then how do I feel inside about it? That's going on constantly. And this is kind of perhaps the machinery behind, what is our intuition to some degree, our gut feeling, our inner guidance, this system. And so this can be maladapted and disturbed. So if you have a lot of trauma and development of your limbic system in your youth, you may be maladapted, you may be guided towards traumatic situations. You may be guided towards emotionally problematic situations. Certain feelings, Yoda. So then the limbic system is also wired into the autonomic nervous system, which I'm sure you guys learned about. So it's this emotional center, it's handling sensory input from outside the body and from within. So it's managing our autonomic nervous system, which I would say is basically kind of our physical subconscious. We have a subconscious, our body, our digestion, our breathing, our heart rate, all these things constantly going on in response to subconscious things inside of ourselves. Unresolved emotional conflicts live out, in that space. Integrating this input and output with our emotions and then the physical expression of our emotions. The system is also helping us understand and tune into other people's emotional states constantly as an instinct as a human being, and then also our own, trying to have a poker face or smile or laugh in response to something you're seeing. It's all part of this system. Here's the autonomic nervous system, pleasure, pass, if it is. So again, you get the psychoneuroimmunology, psychoneuroimmunology. This HPA axis connecting in as an example of an apparatus of the psychoneuroimmunology system. You got to plug into the autonomics, to all our organs, to all the hormonal centers, to the immune centers. And so I'm saying maybe the emotional body has a physical basis. Maybe it's not such a touchy-feely thing that maybe perhaps here it'd be okay to talk about UCSD, it'd be more difficult to bring up. But I say the limbic system connected to the autonomic nervous system, connected to the immune system, connected to the energy system, make up the major network and components of what a lot of people experience at the emotional body. And was described by chakra healers. These guys, somebody brought it up. They've been linking the chakras to these certain endocrine centers and the nerve centers for a long time. And this is the same system that we're talking about right now. So I'm saying that it does seem that there is an emotional body, and this limbic system, which we're seeing, wow, there's a big focus in PTSD and also responds to some psychedelic treatment. So these are reasons why it would be interesting to go after PTSD with this kind of approach. So you got the emotional body, the subtle energy body. That's what a lot of the traditions are saying. This emotional body is connected to the subtle energy body, connected to more mystical realms. That our spiritual being, comes into our physical being, and at the interface there is the emotional body and our emotional experiences. This little thing from NPR, they put out there at this university in Finland, asking people, where does it feel inside your body? Where do you feel these emotions? And they described it, and there was a lot of crossover between what everyone was saying, love from the heart to the mind, to down low, and happiness in the heart. And then I showed anger to my friend's Chinese medicine, and he said, oh yeah, it's liver fire, anger coming up, and that's how people experience it. So trying to come up with the physiology of the network that describes some of this stuff, this emotional body, this energy body, this subtle body. So limbic energy body, say memory is imagination. Like we actually are imagining our memories. We're constantly reinventing them, changing them a little bit, retelling the story. And so this idea, when we talk about PTSD, well, these memories are frozen. They can't be reimagined. Their imagination apparatus is shut down in relation to those things. And so you need to, so past affects the present. Rather than me tuning into the present, my path is making this feel like the past until it's recontextualized. Imagine back into the flow. Until you can recontextualize again, imagine it back into the flow. Either through desensitizing, emotional stuff around those memories, or finding different ways to create a flow. So I'm saying, The energy body, the emotional body, I'm saying it's the limbic system with its amygdala, hippocampus, the pituitary, and the pineal gland. They're saying it's a source of DMT in the body. People are theorizing that, and now it's proven in mice that they do produce DMT in their pineal glands. The secondary neuroimmunology, the secondary endocrinology, the autonomic nervous system. This is where the frozen emotional trauma lies, somewhere in there. Okay, it's connected in this network in our whole body. And we obviously see similar thoughts and processes in acupuncture meridians in traditional Chinese medicine, or Ayurveda with the chakras and the subtle energy body. So energy blockages, stagnation, how do we move these? How do we mobilize these? How do we open this flow? Then I'm gonna quickly just touch on epigenetics. I want to introduce, maybe you guys are already exposed to epigenetics, I imagine, but just to touch on again, epigenetics, this part of our genes that is not the DNA sequence, but is, tagging that goes on the DNA sequence, or tagging that goes on the proteins that are packaging the DNA that are not hardwired, stuck for the rest of your life, but are shifted and changed in response to lifestyle and nutrition and environmental toxicity, Agent Orange, or, radiation from the Japanese plant. I always say this with cancer as a doctor, and everyone's always, where's cancer come from? Where's cancer come from? Where's cancer come from? Oh, it's all genetic, it's all genetic. But then Chernobyl melts down in Russia, and everybody's like, oh, I better get away from there, I'm gonna get cancer. So we know that environmental toxicity is a huge source of cancer. And we know that that causes epigenetic damage. And we also know that, drugs and pharmaceuticals influence that process. Our development is influenced. It influences our epigenetics, our childhood, deep emotional trauma, our relationships, all that stuff influences our epigenetics. And those epigenetic things, which are not necessarily hardwired, hardware from our families, but are possibly, software, things that can be reprogrammed, that can be shifted, that can be changed, are underlying a lot of cancer, autoimmune disease, mental disorders, including PTSD, diabetes. So just a quick note on the influence of epigenetics, how powerful it is, just the cells, the sperm and the egg that have the same DNA as all the other cells, but they can be turned into all these other cells with the same DNA, largely through epigenetic programming to lead to all these different cell types. You can take an adult cell that's already differentiated, unprogram it, influence the epigenetics, and then reprogram it. You can get a stem cell and then use the stem cell to make these other cells. So there's a lot of room, in this software system. This may not be so influenceable, however you say that, but there is a lot of room for activity. So epigenetics is a big deal. Here's an example of these diabetic mice strains that this diabetic mouse was bred to be, overweight and diabetic and yellow. And then they took one of these mice and the mom, and they gave it these, plant-based compounds or these supplements, choline, folic acid, betaine, vitamin B12 in utero. And then the child went back to its previous form, small brown mouse, reverse, not diabetic anymore. So it was the in utero development was crucial in reversing that. And certain plant supplements and other things to reverse epigenetic damage. And another comment about epigenetics, here's another study where they take a mouse and they Pavlovian, they get them scared of some smell. They stress them out in relationship to some smell until finally, every time they smell that smell, all their arousal is turned on. They have PTSD from the smell. That reaction to that smell is actually carried on into several generations afterwards, because the epigenetics, is carried on to the egg and the sperm, and then that passes on. So this is where lifestyle, all these different traumas and all these different stresses can affect childhood and subsequent generations. The thing is well, this is actually supposed to have a good utility. This is the reason why they believe this exists, is that some animal or some human adjusting to some environment, you want to be able to develop instincts that are going to get passed on. That you instantly know, oh, that's bad, we'll stay away from that. Or this is good, I should go towards that. So this is part of our instincts. The problem is when you stay in traumatic environments and difficult situations, you get all this epigenetic imprinting that gets passed on. So Time magazine mentioned this, same thing, wiring DNA is in your destiny. So just another note on this with emotional trauma, these monkey studies where they take these rhesus monkeys and stress them out and neglect them and try to see, what's wrong when they neglect them, take away from their moms. What is the damage? Because they see that these guys have early life adversity associated with broad scope of lifelong health and behavioral disorders. So it stays with them for life, this damage from their childhood, unless perhaps there's some kind of intervention. And they're saying, what is the difference? Well, what we see is DNA methylation. You see epigenetic imprinting in these limbic and paralimbic areas. That's where it's marked. That's one of the areas where it's marked. So, childhood maltreatment, same kind of thing. They're saying, wow, how is this leading to these lasting damages in the HPA axis and the stress system and the immune system, everything we just talked about. Saying, oh, it looks like it's happening through epigenetic imprinting. So at our center, we have this clean environment, this healthy community, this mystical component. So it's a nice place to try to address the emotional body and the epigenetics with spiritual medical intervention. And what we see is we see a lot of success with what the shamans refer to traditionally as spiritual illness. They would link, like, these are the kind of problems that people come with, that all the shamans say, well, this is spiritual illness. To some degree, there's probably varying degrees, but emotional, psychological trauma, anxiety, PTSD, all this stuff. So they say traditionally these people's, their energy body's compromised. That's what the shaman's saying. We're in the ceremony, drinking ayahuasca, seeing the person, they see their energy body disturbed, and then they're singing to try to undo those things, clean those things. All the songs, that's what it is. That's the shamanism that we practice. It's all about cleaning and clearing, opening, untying, helping the back in the flow. So this woman that came to us as a different kind of case, a form of PTSD. She realized that she had been abused sexually by her family member. She was not aware of that previous to this experience in the ceremony, and then it came out and was verified and all this stuff. And uncovering that and working through that through spiritual work in the ceremony and with the help of the master plans, she was able to come out of this fatigue, the depression, the low back pain, the knee pain, the weight struggle that she was suffering with. She was treated for 5 months, okay, just so you guys know. She was the one that handed me this book that I'm always trying to promote, General Theory of Love. General Theory of Love is all about how the limbic system is so influential in all these illnesses that we would call spiritual illness. And she said, this is what you guys did for me. They explained it in this book. You healed my limbic system. So I would check it out. So they talk about this idea of limbic resonance, the way we tune into each other emotionally. Also, the idea of limbic regulation, that as we tune into each other's emotional states, as we share inner worlds through eye contact and being around each other and all these instincts that we have, that eventually we influence each other, and with a horse, we could do that, and with a dog, we could do that. And then over time, limbic revision, which is therapeutic alteration of the personality, improving emotional health, stress coping mechanisms, and choices in relationships. So they say they do this through psychotherapy over years by providing loving support to somebody, limbically resonating with them with love. Not so much, doesn't matter what you talk about, but just giving that support. And perhaps that's part of what's going on in some of these prolonged exposure therapies and these CBT therapies, is that someone is reviewing their trauma, they're reviewing something that you're reflecting back to them from a loving place. And that helps to retune, to revise the limbic system. The issue is this takes years, the psychotherapeutic process. But, with us, sometimes we get there faster. So people primarily come to us for emotional healing, limbic revision, which is then treated through a larger spiritual context. Psychotherapy is thought to work through prolonged limbic regulation with the therapist and resulting limbic revision. In many cases, traditional approaches, which include the ritual use of ayahuasca, can be much faster and effective for treating limbic revision. And so, give us a chance. It's illegal right now. We're trying to help people. And we agree that, but we agree, like Russ said, should be very careful with it. But within the right context, it's powerful. There was a guy, I gave a talk in San Diego, and this guy told me he's Iraqi vet. He shot his best friend on accident. Back at some accidental fire. Killed his best friend. And he said, I went to therapy, I went to everything, I was able to function. He has a family, he has kids. He was able to function and everything, but he just could not, the guilt of it. There was no way out of the guilt of it. And then through ayahuasca ceremony, he had this huge release from the guilt. It's like deeper emotional trauma, these emotions, these feelings, that just you have to get at the subconscious. You have to go deeper to release from these things. So this rapid limbic revision through traditional treatment may in part occur through epigenetic changes. Charlo, chilling. So I'm saying the spiritual illness that the shamans are describing in all these people, it seems like it's limbic dysfunction, neurolimbic dysfunction. We hear a lot of people talk about it, and there's growing body of research around neurolimbic basis or dysfunction in addiction. A lot of stuff about the limbic system. Anxiety, depression, yes, all this trauma. headaches, all gets to that autonomic dysfunction, like we talked about, the connection, the emotional body to the autonomic, so irritable bowel syndrome, improper reflux, high blood pressure from too much tension in your cardiovascular system, all these different things, autoimmune disease, disruptions in the immune system, and inflammation associated with emotional problems, chronic fatigue, some other problems we've treated. People say, this limbic dysfunction, in these cases, they need cleaning. That's what they need, clean out the bad energies, the malas energías, and the darkness. So we heal by working to clean the spirit and the energy body, accumulated dark experiences, energies, traumas, etc. If you don't treat these problems, there's people who you'll just get ill and more ill. I went to South Africa, Zulu, Sangoma, that's what they're into. They're doing the same thing, totally independent, another part of the world, they never talk to each other. Zulu, Sangoma, and people shaman. And they are doing ritual bathing, plant baths, vapor treatments, and vomiters to cleanse, spiritually cleanse, the emotional body, the energy body, prevent illness. Does allopathic medicine, does the MDs and all these things, we have some concept for this idea of accumulated energies, and there is. It's called allostatic load. Allostatic load is referring to adaptations to stressful situations. These stress adaptations accumulate in the nervous system and the body, affecting our stress response. So saying it accumulates in the emotional body. It's burdened over time by stress, it's overburdened. So you have cortisol levels, adrenaline levels that can be measured to indicate this, certain inflammatory markers that can be measured to indicate this, disturbances in the stress response system from too much new stress, too many different kinds of stress, inability to meet the stress that's coming your way, or inability to calm down. So the stress response system, we talked about the HPA axis, hypothalamic pituitary axis. So allostatic load of PTSD. So it's pretty clear. PTSD is like, the stress response system is been maladapted from repeated recurring stress and war. It's pretty clear. The scientists agree on this. And so I'm saying, it seems like it's totally related because the shamans see us and it's like, this guy's got all this war energy in him. We got to clean it out and we got to clear it out. And it's reflected in his allostatic load. It's reflected in his limbic system. It's reflected in the stress response system. Migraines, they're saying, this is an example. There's maladaptive stress. Something was going on during the development, and he has maladaptive stress. Now certain things trigger the stress. Chronic fatigue syndrome with high allostatic load. So I'm saying accumulated energy stress from childhood maltreatment or psychological trauma like combat leads to increased allostatic load. Allostatic load represents the maladaptive functioning of the PNI system, the HPA axis, which includes our immune system, the emotional body. As allostatic load leaves us less capacity to cope with stress and often leads to further long-term pathology, migraine, chronic fatigue syndrome, PTSD, problems traditionally described as spiritual entities. Here's a thing on epigenetic mechanisms. So epigenetic, like I said, it's got some imprinting happening there. It seems to be epigenetic. So antidepressants are saying, well, this is working that, epigenetics is like chromatin remodeling, subsequent effects of genes within limbic brain regions contribute to the pathogenesis of depression and other stress-related symptoms, PTSD, anxiety, limbic software. I think we should explore the possibility that we at the ayahuasca healing centers are cleaning allostatic load, pathologically imprinted epigenetics from our emotional centers, which, by the way, are hardwired into our tears and our vomit. As the shamans would say, cleaning darkness from the emotional body. And in the end, this happens through love. That's what ultimately happens in the experience. Is people are trying to find self-love, they're trying to find forgiveness, they're trying to find gratitude, they're trying to find compassion. And those are these transcendental concepts. They're not concepts, they're experiences that you have that allow for some of this stuff to reset. And you have to feel it, and you have to live it for it to change. So now we'll get to questions and answers. All right, so we'll bring Russ back up. We have a little bit of time now for whatever you guys ask us.
Is it on? Yeah, Joe has to have me back in the hospital by 5, so.
That's right. Now they have class.
Oh, they have class.
Go ahead.
I have a question. When you went to the center, did you have did you have a general idea of what your issues were, or was it something that was kind of revealed to you as you went through the process?
Repeat the question. Okay, the question was, did I have an intention when I went to the center? No. Just went. And it's a good thing if you can have an intention, but my attention span doesn't allow me to like do an intention prayer because my mind starts wandering all over. And so I just went with whatever happened, wherever it took me, and then processed it later. But it's good if you do have a clear intent, right?
Yeah, we encourage everyone to have an intention. Inevitably, that changes. You know, people they always come in and say the same thing. Oh, I want to be filled with love and light, talk to the spirits, and find my way of service, or all this talk, the talk. And then, eventually you have to get into the nitty gritty of like what's going on.
So I guess what I meant was, like, when you went there, did you know what those nitty gritty things were? Or are they kind of revealed to you along the way?
Some of them you know, and some of them are revealed to you. So the ones you know, so we encourage people like go into the ayahuasca ceremony with an intention around something. I want to feel this, my relationship with this person, or whatever it is. So you focus on that. So you use that focus to help guide you through what can be a difficult, confusing experience. And you're asking for help. Because, really in the tradition, you're trying to come into a dialogue with the ayahuasca to ask for help around this. And then through that process, you may be guided in a different direction. So you don't have to know it.
You mentioned you work with the VA. Do you work with the VA to encourage like OEF and OIF vets that are coming back now?
Yes, yeah, because most of us guys are dying off, so.
What's the question? Say the question.
Oh, I'm sorry. Do I work with the Afghani and Iraqi vets that have come back recently? And my answer is yeah. I've taken in homeless vets.
But do you bring them down to Peru to
No,
experience what you did?
it's kind of expensive to do that, but I have taken them to the VA and got them going and that kind of thing, and help them over rough spots. But no, I wished that they would legalize the process here in the States, because I think a lot of them would benefit from it, especially the guys from Iraq and Afghanistan, because our terrains are real similar. That's what kind of put me over the hump was the jungle.
At the first concept of the presentation, you talked about how you use floral aromatherapy as well as EPM and all. Did you use any, because you said counseling was an active list of things that you practice in the group, did you use any other counseling tools or both?
Yeah, the question is, did I get it? I'm going to cut it down a little bit if it's okay. If I leave part of it out, let me know. Did I do any other counseling after I got back from Peru? Yeah, I still go to a group, PTSD group, and I also went and did that 3-week program, that intensive inpatient residential. It's not an inpatient because it's small in Tucson, and that was very helpful for me. I might have not been open to that. I'm pretty sure I would have been if it hadn't been for the trip to Peru.
And for us, we don't have training. We're interested in that, learning more therapies and working with people, but for just like the natural, just the Mosquita, me, Ricardo, people that are just doing everything they can to try to help somebody through the process, gain the experience. Me as a doctor, things like that. We're open to that. We're interested in that kind of integration. We think it would be more effective. There's a couple opportunities. I know one. That's the only opportunity. I know a couple people that are friends of mine. The question was South Africa. Is there any center? Is there something going on? And I think that's an area where there could be some cool stuff we can go and do as well. So I know one lady that has journeys, and you go and you meet these different healers that she works with. It's a little expensive, but hey, it's really open. Something. She's a friend.
One of the things I liked that I didn't touch on earlier was that I used to think that the PTSD was a BS diagnosis, until I started experiencing it myself, because I see people talking about it, and my interpretation was they probably had a messed up childhood in the first place, and they're just weak individuals and stuff, and can't deal with it. But I got a rude awakening, so it is a legitimate diagnosis.
So, awesome. So Russ, what would you say were the biggest benefits you got from your experience in Peru at the center?
Okay, I think forgiving myself for a lot of the stuff that I've done, and to me, I think you need to forgive yourself before other people can forgive you. You know, you only have control over yourself, and the other folks don't want to forgive you. That's up to them. You know, but you got to be at peace with yourself. Is the main thing. That effort. I can repeat the question.
The question was, what was one of the main things that you got out of your time in Peru? Let's talk about forgiveness, you know, and I think forgiveness is just an interesting concept because it's a concept that has existed in the spiritual traditions forever. And even the psychologists, you know, it has to be addressed. It's like it does have a mystical side to it, you know, but it's really hard to wrap your head around what exactly it is. And so, you know, Carl Jung was one of those people who was saying that, you know, forgiveness is a place where you see spirituality intersect with psychology. And so there's this idea of like, how do you forgive yourself? And, you know, one thing I read about was like, well, it starts as a mental concept, you know. All you can do is think about it and try to do it and try to do it and try to do it. And then it doesn't happen until you feel it, you know. And then when you feel it in your emotional body, you know, in your subtle body, in your being, then, you know, something shifts. But it does seem that, you know, the plants, for example, the ayahuasca, can help you through that process. It can help you to learn how to do that. You know, and we see that time and time again. And that's the idea that you need, you know, the idea is basically that it seems that some kind of spiritual approach is very beneficial in trying to help people forgive themselves.
So when you're working here for Cigna and you encounter patients with IBS or Crohn's or fibromyalgia or other autoimmune conditions that have this strong mental emotional component to the pathology of the disease, how do you reconcile that, or do you feel that your hands are sort of tied or you're limited in the ways you can approach the issue because you know you can't get to the root of it?
Yeah, well, I mean, I think it's a complicated issue because the reality, you know, of patient care and the reality of even what we do in the Amazon is the patient has to do their part. In traditional medicine, that's just standard. You know, there's no argument that the patient has to do their part. But at Cigna, you know, everyone's just the average American is paying their insurance, and my employer, you know, they pay for it and fix me. You know, they don't want to lift a finger. And so you see these doctors that seem all burnt out on patients and stuff, but it's like, well, it's one thing to deal like in a more alternative field where you get all kinds of people that are looking for help, they're looking to heal themselves. But there's a lot of people, unfortunately, sadly, in our society who are not interested in their own health. So that's the first thing, is like trying to, so in other words, that's where it's easy to walk away. Because you bring it to their attention and say,
Oh, I'm sorry.
You want to say something?
No, I just have another question.
Okay.
Wait a minute.
Okay, I'll finish this real quick. So my thing is like, first, you gotta find the person that's willing to engage, you know? And then once they're willing to engage, then it's like, bring it to their attention. Like, yeah, it seems like, you know, this is related to these other things, or you see that a lot. You know, I see that a lot, right? And then see where that goes, you know, little by little. There's a nurse that, so now the ladies that work there, they're calling me the shaman, you know, I work for, just for fun. Because this woman has these bad nightmares. You know, she has bad nightmares. And so then she doesn't sleep, and so I got her to go to Southwest Herbs to go. She's tried all this other stuff, and it doesn't really work, and she doesn't like it. And she's taking this stuff from Southwest Herbs, and she's finally sleeping. You know, so she's coming around. You know, before she just give me something, and I'm like, okay, now are you ready to, you know?
So it's just about opening the conversation.
It's about opening the conversation, and so that's a process. That doesn't always happen in a 10-minute visit, and so does it break my heart? No. You know, but when I'm there trying to help, you know, and so we bring it up all day, and there's other people bringing it up too. So people need to come to it a little bit.
Yeah, I heard the one question.
I'm sorry.
I was wondering how your diabetes and your other diseases that you mentioned were affected by your trips.
Actually, they reduced my medication. The question was how the diabetes and the heart disease and all that stuff is affecting me now. They've come back on my medication a lot for the diabetes because it's pretty well managed. And
Do you feel that these trips
Oh, yeah, yeah. I retired 10 years ago, in August, this coming August. And I weighed about 248 when I left. Between the time I got out of the national guard, I had some motivation to maintain my weight and set up. And I'm down to 189 now, which is pretty good. When I joined the Army, we went and I kept it extremely better. But yeah, I think all that stuff helped. You know, I never thought of myself as a stressful person, and Guillermo, the guy at the first place we were with, she went on asking us what we thought we needed. And I forgot what I told her, probably a lie, I don't know. And he said, well, what about all that stress in your shoulders? I have no stress in my shoulders. And I guess he could see the energy or whatever it was. Remember that? And so I said, okay, we'll work on that too. The baths, the floral baths and stuff, I just love it. You know, I used to have to say, hey, let's do baths. Everybody's looking at me, what's wrong with you? But I love it. And you spray this, you get a bucket, you throw this water on you, and you just need the plants on you until they just fall off naturally. So you don't even dry off, you can swat around. If you're real brave, you can go nude. You know, I'm not quite that brave yet. Yeah, and I just loved them. I really did. They were very, I don't know, cleansing, maybe very peaceful. Whatever it was in them, I don't know what it was. But anyway,
Flowers,
yeah. Did I answer your question? Okay.
Any more questions? I think we're almost done. You guys to go to class now.
One more question?
So, for you, if you've worked with any other vendor, you already talked about it a little bit with your experience. When you're during the ceremony after you've taken the ayahuasca, you know how like the noises in the jungle and everything, or the guy sitting there with, like, how did that trigger you ever to be afraid or anything like that?
That trigger was made 40 years ago. You know, what it did was the 45 minutes was very, very intense for me. I feel like calm down. I just felt really good after it. I got off on looking, and this is when you're straight. It's when you go through calm down during the ceremony, the day after, or the evening after. And after that, it was very relaxed and very peaceful, and I enjoyed it. You know, and I think that was a big breakthrough. I don't know what it did to me, but it did something that was very positive.
Well, I remember my first week was similar like that. Like, I had a really hard time going to sleep. I was scared, you know, paranoid, all that stuff. And I can't imagine if you had some, you know, if you had been in your bed and all that stuff, I would think that would be even harder, you know, having gone through that experience.
You know, one of the things that kind of relaxed me when I was there was these old people's cars and stuff that walking around with shotguns and stuff. I felt a couple, you know, they kind of look like Vietnamese in a way, and they're short, kind of friendly and stuff. Okay, I gotta cut it off, sorry. I'll be around afterwards, you guys don't have to pass.
Yeah. So now we're going to bring this talk to a close. Let's give Dr. Tafur and Russ a thank you. Also, we're going to do a thank you for Ron and Sue and Naturopathic Society and everybody else making this possible.
Remember, we still go.
So we do have to clear this room out to let the next session come in. We do have a sign-in sheet. Where's the sign-in sheet? Show me where it is. Okay. If anyone hasn't signed in, please go see Susan. And if anyone has any more questions please sign in before you leave the room. We need to keep track of who came here. And actually, Dr. Tafur and Russ will be outside the building to answer questions if you want to talk to them more, just to respect the next